Hi guys, I'm here at Surface Health Medical Centre today seeing my GP, Dr. Jeffery, for my first antenatal visit, and also to get a referral for a private obstetrician here on the Gold Coast, Dr. Sem. So thank you so much for seeing me today, Dr. Jeffery.
Pleasure.
So why should women who are in the early stages of pregnancy see their general practitioner?
Well, there's many reasons to see a GP initially. First of all, to confirm the pregnancy is very important, to identify any past problematic pregnancies and their outcomes, to determine what strategy you're going to use to manage that patient. Some patients might want to do a shared care process, others might prefer to see their usual obstetrician and gynecologist. So once we've established that there's no major problems, before we get to that we need to do several blood tests, check urines, and depending on the gestation, certainly if it's more than 6 weeks, we would go on and order an ultrasound. After that, we would then discuss with the patient to have a chat about their nutrition, to discuss if they want to undergo further genetic testing, which the majority of people do want to do that, and that's readily available at various radiology practices. So the very early part of the consultation is just to establish the pregnancy and then to sit down and go through how share care would work at a GP level. And in many cases this usually can extend throughout the duration of the pregnancy. And once they get to usually around about 20-22 weeks, they've had a morphology scan, we would then rediscuss with the patient if they would like to go on to have a midwife manage their pregnancy or stay with their GP. It's important to also to identify high-risk pregnancies. So patients that have underlying severe medical conditions that could impact their outcomes need to be referred to the hospital sooner. Equally, twins or triplets and so on and so forth also would fall into that category of a high-risk pregnancy. So these are things that you would establish early on in the program and then coordinate with the patient and the hospital to take the necessary steps to see that patient to ensure that we get good outcomes.
Now Luke wanted these blood tests done, but I've actually had these done. I got them done because the liver test function here.
This is first one.
Yep, so Ehrlich. So I've got it here actually. So it's Dr. Ehrlich. So E-R-L-I-C-H.
SEN.
SEN, yes, so Dr. Sem. So apparently Dr. Sem is a very good surgeon, so because it looks like I'll be having an elective Caesar, having hopefully not too bad a scar to recover from afterwards, or if not too bad a wound afterwards, will be great. Thank you so much. Well, thank you so much for seeing me, Dr. Jeffery.
Thanks,
and stay tuned for more pregnancy vlogging, as hopefully this baby bump is just going to keep growing. Okay guys, so I've had my first antenatal visit with my GP. I've got a referral to see a private obstetrician here on the Gold Coast, Dr. Sem. I've had all my bloods done, and most importantly, one of my blood tests that I had done last week has come back good, which was the liver function test, because I got covered in hives, but so we were worried about my liver function, but that's all good. So this is done. So this is another milestone along this journey of pregnancy. So stay tuned. Hopefully everything's going to go okay, and baby bump will just keep growing.